Thank you for participating in the Absolute Support Coordination New Hire Orientation. In this session, we will review relevant policies and procedures regarding the structure and organization and administration sections of the Policies and Procedures Manual. Your trainer or supervisor may add additional material to this orientation. Mission Statement. Quality Independent Case Management, LLC, doing business as Absolute Support Coordination, exists to be of service. Our mission is to act as a resource for our clients at the individual and institutional level and prove that case management or support coordination can be both personal and cost effective while serving the needs of our community. The following are key goals inherent to Absolute Support Coordination's mission. 1. Quality in client care and service is and will continue to be the company's primary goal. The company will meet or exceed all standards of practice established by regulatory agencies, accrediting bodies, professional organizations, and other behavioral health service providers. The company will service client needs with professionalism, consideration, and an incomparable level of care. The company will provide services in a cost-effective, efficient, and effective manner, and in doing so, prove that case management and support coordination services can be delivered without sacrificing the interests of stakeholders. To meet our mission, Absolute Support Coordination commits to the following goals: to provide the highest quality of care that maximizes the functional abilities and quality of life of our consumers, to be ethical and honest in all of our business activities and relationships, to be the behavioral health services employer of choice by providing a work environment that promotes employee retention through open communication, encouragement of creative thinking, and provisions for professional development and work-life balance, to identify new opportunities and resources that support the needs of our clients. Target population. The target population for the company is defined as below: individuals who demonstrate a need for behavioral health services, i.e., support coordination, in order to gain access to the full range of needed services, including medical, social, educational, vocational, and other support services. Target populations are further defined as individuals participating in the MRDD waiver program, as well as adult individuals with developmental or physical disabilities who seek to contract for case management or support coordination services. Scope of services. Absolute Support Coordination provides support coordination services to clients in need of assistive support in obtaining access to the full range of needed services, including medical, social, educational, and vocational, and other support services, to assist each individual in increasing his or her level of functioning and create inroads to improvement of adequate functioning in all areas of normal life, to help clients become more independent and to better adapt to normal lifestyle and improve the client's independent living skills, to assist in empowering clients and families to achieve their highest level of functioning through the promotion of greater self-esteem and to encourage the development of emotional growth and self-determination, to assist in developing more positive and productive habits that may lead to a healthier lifestyle, to assist the individual and or his family to locate services and resources that will aid the client in immediate, short-term, and long-term circumstances. Consumer services will be provided in a consistent fashion until the consumer elects to change providers. Requests to cancel services be determined by evaluation that the company cannot effectively provide services or the consumer has developed in such a way as to no longer require support coordination services. Hours of operation. Absolute Support Coordination maintains that its consumers should have access to support coordination services and behavioral health support 24 hours a day, 7 days a week. The company shall provide face-to-face support coordination services, meeting consumers where they are in the community between the hours of 7 a.m. and 6 p.m. Monday through Friday, Central Standard Time. The company's executive and operational offices are open Monday through Friday from 8 o'clock a.m. to 5 o'clock p.m., except for designated holidays. The company will maintain an auto-attended phone system that will allow clients to leave messages for administrators or support coordinators 24 hours a day, 7 days a week. The company will maintain an auto-attended phone system that will allow consumers to leave messages for administrators or support coordinators 24 hours a day, 7 days a week. The company will also maintain an emergency phone line for 24-hour, 7-day-per-week direct access for consumers in need of an on-call case manager or support coordinator outside normal hours of operation. Remuneration for referral. Remuneration or payment to referral sources for the referral of clients or consumers is against company policy. This policy applies to all company team members and all referral sources. It is against company policy for any team member to offer or deliver remuneration of any kind to any person or entity for the sole purpose of receiving consumer referrals from that person or entity. Any team member who offers or delivers remuneration for a client referral will be disciplined up to and including termination of employment. The policy is meant to comply with all state and federal guidelines for the definition of illegal remuneration. This policy shall not limit the company's ability to pay other legal remuneration to persons or entities working on behalf of the company. Inability to provide services. The company will assess and evaluate each individual client to be certain that he or she meets documented criteria prior to admittance to the company's active consumer role. However, there may be times that the company may no longer be able to provide services to assist the client in an efficient and effective way for various reasons, i.e., unable to meet the needs of the client has outgrown the need for continued services, the client selects or elects another service provider, etc. In such events, the company will do all it can in assisting clients in finding new resources that fit their needs. All consumers will be notified in writing 5 days prior to discontinuation of services. The consumer's family, caregiver, or other responsible parties will be notified as necessary. If applicable, the provider of choice will be contacted to arrange for the transfer of the client. All pertinent information shall be communicated and transferred to the accepting provider as to provide little to no interruption to the consumer's recovery process. A discharge summary will be generated and forwarded to the accepting provider with a copy filed in the consumer's chart. If the consumer is being discharged due to no longer meeting established criteria, The company will work with the consumer to find resources to meet the consumer's needs. All team members will be notified of any consumer's discontinuation of services and the transfer or transitioning to a new provider of choice. All consumer records will be stored in accordance with the medical record retention policy of the state of Louisiana. Ethical Issues Ethics Committee. The company will provide a mechanism for the consideration of ethical issues that may arise in the day-to-day delivery of services to its consumers and its business operations. Situations which may arise regarding ethical issues may include, but are not limited to, client refusal of services, value conflicts arising from personal, professional, and company disagreements, disagreements among professionals involved in the consumer's care, consumer and family concerns, consumer living in an unsafe environment, consumers who are seriously non-compliant, consumers whose care is compromised by family-related issues. The consumer has the right to participate in any discussion concerning ethical issues related to the provision of services. Team members involved in the servicing of the client should be involved in any discussion concerning ethical issues regarding the consumer. All information must be maintained in a confidential manner. The company will have an ethics committee consisting of the managing director, the program administrator, and at least one of the following: support coordination supervisor or sitting board member. This committee is responsible for consideration and discussion of any ethical issues which may arise while the consumer is receiving services from the company. The company ethics committee will meet as deemed necessary by the committee chair. When an ethical issue or concern cannot be easily resolved to the satisfaction of all parties involved, the ethics committee should be consulted using the following procedures. Submit a request for consideration to the chair of the ethics committee. All requests will be considered. The request may be submitted anonymously. However, if feedback is desired, the individual submitting the request should identify themselves. The request may be submitted by phone or in writing. The ethics committee will meet to discuss the issue and determine which parties need to be involved in the resolution process. The ethics committee evaluation of the ethical issue may include the following: weighing of all options, permissible versus ideal solutions, establish priorities, compare to other cases, assess consequences or outcomes, legal consultation as needed. Implementation of the ethics committee may include the following: documentation to appropriate file, team approach to implement recommendations, written notification to relevant parties, and monitoring outcomes. Incident reports. All serious incidents, i.e., accidents or injuries, or any occurrence which has the potential for affecting the welfare of other consumers, involving a client or staff member on program property or at a program-sponsored event, must be reported immediately to the managing director, the program administrator, or the support coordination supervisor. Examples of serious incidents are attempted suicide, death of a consumer, accidents, illness requiring hospitalization, injuries, fights or physical confrontation, suspected cases of abuse and/or neglect, unusual incidents affecting the health, safety, or well-being of a consumer. This report must be reviewed and completed within 24 hours of the incident. All occurrences out of the ordinary will be documented and investigated as soon as possible after they happen. The report will include the following, and a copy of the report will be filed in the client's record and be available for review by appropriate personnel. Date and time of incident. Name of consumer. witness and or staff members involved, circumstances under which the incident occurred, statements from consumer, witnesses, and or staff members, a detailed description of the incident, a detailed description of the proceedings or methods used to resolve the problem. All incident reports shall be reviewed and evaluated by the managing director for potential referral to the board for additional review to assess if corrective action may be taken to prevent future incidents. Consumers or team members who have sustained an injury that requires immediate medical attention are immediately referred to an acute care facility. All consumer and or team member accidents or incidents are reported within 24 hours of the incident, describing all circumstances in detail. The legally responsible person or the nearest relative or caregiver will be notified immediately with written notification to follow within 24 hours. Completed incident reports are submitted to the managing director and or the program administrator for review and investigation. The managing director obtains the physician statement and signature as appropriate. The managing director may determine if a physician needs to be notified and which physician should be contacted. Copies of all critical incident reports are kept as part of the consumer's record, and a separate copy is kept in the administrative file along with documentation of compliance with procedures. Incident report analysis. The company will maintain a log of all incident and accidents occurring on company property and or company time. This log will be completed on a quarterly basis. The incident or accident analysis will be reviewed by the Continuous Quality Improvement Committee on a quarterly basis. It is the responsibility of the Continuous Quality Improvement Committee Chair to complete the analysis in a timely manner to ensure review by the committee.